Madam Chairman, Ms. Rosano. Here. Simpson.
Here.
Cleary.
Here.
Epicoro.
Here.
Andrew Joyce.
Here.
Miller.
Present.
Lockhart.
Here.
And Moriello.
Here.
You have a quorum. The first item is approving the previous meeting minutes.
Does anybody have a question about the minutes?
To approve it. Second.
Thank you. All in favor?
Aye.
Opposed?
All right, item 2 is authorizing agreement, right side up, regarding registration and inspection of all child care providers in Albany County. Commissioner Stackowitz is here this meeting.
Good evening. Thank you for having me here this evening. So Department of Social Services is looking for approval to renew an annual agreement with Bright Side Up and the Office of Children and Youth and Family Services. It's to receive federal pass-through funding for Bright Side Up to provide assistance with the registration and inspection of all child care or daycare providers, both in-home and other providers that are more national or more larger providers that are not based in a home-based setting. They conduct comprehensive evaluations of health and safety requirements for all of the daycare providers, including criminal history checks and child abuse and maltreatment checks of every single provider that goes through their system. They carry out any investigation complaints of any daycare providers that come through their system. They provide outreach to our low-income neighborhoods in a targeted outreach effort to make sure we can develop more family daycare providers, since there's a shortage of those currently. And they assist families in trying to identify safe and qualified child care so they can get their children into various child care systems. They also provide training to providers and parents on topics such as early learning and development and nutrition and physical activity. The contract is to provide the services up to not to exceed an amount of $292,983, and it's 100% federally funded. And it is pass-through funding that comes through the State Office of Children and Family Services to Albany County.
Are there any questions?
So, obviously there's pass-through funding, and we know child care is a big issue these days, but we also want to make sure there are, good child care, so we just want any child care. When they do these reports, do these go to the federal government, do they come to you? Who gets the reports when they do
They
these?
go to the state,
They go
actually.
to the state?
Yes, and then they're online that we can see pieces of it. If there's an investigation done, they will let us know.
Okay.
Or any inspections. Most of them are online on a portal that the state has for public consumption.
Okay, so you guys can go in and see it?
Yes.
And then if there is deficiencies or violations, the state follows up, or we have to follow up?
No, the state does
The
all
state
of
still
that.
does that? also?
Yes.
Okay. All right, thank you.
Anybody else? I have a few questions. Does the county certify or license the family daycare?
No, that is done through the state, and then
Okay.
Bright Side Up is the agency that goes out and inspects to make sure that they meet the licensure and regulatory requirements. So they're the entity that does all that. The county doesn't do any licensure or inspections of these facilities.
And if somebody is interested in doing it, what's the process? They contact the state? Do they contact social services?
There's an application process they have to go through, and it's an online application process that they submit all the paperwork, and then inspections are done. They have to make sure they have all their background checks, information is completed, and then if the state approves them, then the rates are set based on fair market value for child care services. So all of that is done through the state level. The only thing that Department of Social Services does is approve individuals for a daycare funding, which is separate and distinct from this particular project.
Are they, the family daycare, I'm gonna say mothers, but whoever it is, are they mandated reporters? Because I noticed in the description, it said that they investigate the complaints, so are they mandated reporters for abuse or neglect or
Yes.
whatever they might say?
Yes, they have to go through a number of trainings and requirements in order to maintain their licensure or their active, ability to provide child care benefits to the individuals that they're providing, whether they're a licensed daycare facility that's more, corporate-like in nature versus a family-type home one.
Thank you. Mr. Bergeron?
Thank you very much, Madam Chair. Erin, how many licensed daycare slots do we have in Albany County?
Right now, I can tell you, we have 520 active child care providers that are
Okay, that's
providing.
providers.
Providers,
Okay.
and we're providing 1,082 families with childcare, and of those 1,082, there's 2,312 children that are getting take care benefits.
What would be the amount that we would like to have in Albany
I
County?
still think there's a need out there. I don't think we have enough providers. There's a shortage of providers currently to provide the daycare slots that we need. So I couldn't give you an actual total.
So, but that is licensed daycare slots,
Yes.
so there's obviously lots of other
Unlicensed,
things
right.
happening.
Right.
Yeah, okay. I'm just curious where we stood in terms of unmet need.
Yes. So we currently don't have a waiting list. We're continuing to open applications for our individuals who are eligible and providing daycare. Some of the counties across the state are not at that same juncture. We still have enough funding to do that, so.
Okay. Thank you.
Mr. Pecora?
Thank you. Do you have like a concentration of need, like a specific area where you need providers the most right now?
I don't actually, I don't have a study that shows where the need is the most, that I don't know. I could probably ask the state, they may have a better sense of that.
How did you come up with the knowing that you need more providers? Is it like there's a specific number that the state required?
There's not, it's based on the need of the population. So you may have a family that lives like in the 12206 zip code, but maybe there's not enough providers in that area. So they may have to travel further to get to a daycare provider, or they may just have to hold off and not be able to register or get enrolled in a daycare provider program until they can find one that's available to them.
So you can figure out where you where the need lies then, without going to the state.
Right. We probably could do that, yeah.
I just have one more question. The daycare slots, are they specifically for parents who are working, or do you work with protective unit and those children need to be out of the house for the day, or?
Yes, there's our high prioritization for any child that's involved in child protective services so they can have a stable, safe environment to go to during the daytime. While CPS is involved, it's preventative daycare. And then there's a number of individuals, depending on whether they're working and or attending an educational program in order to better themselves to become self-sustaining, they can get child care benefits as well.
Are there any other questions? Have a motion? Second.
Second.
All those in favor?
Aye.
Opposed? Motion passes.
Item 3 is authorizing renewal of an agreement with Together for Youth regarding the provision of the functional family therapy program. Commissioner Manning is here.
Good evening, everyone. Hopefully everybody survived the snowstorm. But functional family therapy is an evidence-based practice. It has very high evidence that they are successful once they complete the program. The program is 10 weeks long with families, and it's really focused on the strengths of the families and working the parent-child relationship. This has been something that we've had in the past by another provider, but Together for Youth has been successful in receiving this RFP award. They really look at children that are involved in the juvenile justice system, the mental health system, or child welfare. And what we want to do is, if the child does need to go into care, getting them back in the community as quickly as possible and bridging them to ongoing services. So there's a clinical component and then there's a case management component to bring the linkages in either between the school and the child, but to help that transition so the child is successful.
Any questions? Ms. Walker?
Did you say that they measured success by completing the 10-week program?
It's 10 weeks, they're flexible about that, you know, what if somebody missed a few courses?
Right.
Because it's really, they go by a curriculum and they really follow
What
it.
about beyond that, though? Because you're still involved with the child, the family through the caseworkers or foster
Correct.
care or whatever?
Caseworkers or probation,
Mhm.
you know, if they hit the juvenile justice system again through family court, we'd be looking at other preventive services entities. But, you know, they've also, in the past, actually, Together for Youth as Berkshire, had the contract, they would give booster sessions for the families, just to try and get them right back on track.
Mhm. Good.
And they'll serve 12 families at one period of time.
How many though throughout the whole course of the year? Some people are a little confused by that. It's not 12 families for the year, it's 12
No,
families
it's 12
at a time.
families for then 10 weeks, another 10 weeks, and there's groups of
Through the whole year.
folks coming in.
So
I
10.
can't do the math that quick.
No, I couldn't, that's right, it's a lot of families.
Any other questions?
Just to follow up, you answered most of my questions in your presentation, but following up on Patty's question, typically at a given time, are there 12 families being, I know, I'm sure it can fluctuate, but what's typical? Is it 12 families at a time, you only get 6 or 5 at a time?
Yes, and I could break that information out. We track it on a monthly basis, so we know who has completed the course and, you know, how many openings there may be for services.
But it's typically, I'm assuming it's typically full?
Yes.
Or close to full?
Because we get a lot of the referrals from family court or probation, as well as our child welfare and mental health.
Okay, thank you.
Are there any other questions? Can I have a motion? Second?
Thank you.
All in favor?
Aye.
Opposed?
There are no further items on the agenda.
Motion to adjourn?
Second.
Thank you. Thank you all for coming out and freezing cold.
Maybe it's gone or something, it goes over.
No, here it goes.